And we are back. Well, during the pandemic, lockdown orders were implemented. And as they were implemented, lockdown does not mean that you should put your health on hold. It's just as important for you to see your local doctor, and you can visit them for non coronavirus conditions. Our next guest is working towards adapting the resources he's providing in order to meet the needs of his patients during this post-COVID crisis, and I should say COVID and post-COVID crisis. And here to tell us a little bit more about that is orthopedic surgeon, Dr. Arnold Wilson. And Dr. Wilson, good to have you.
Good afternoon.
Good afternoon. Listen, I want to talk to you a little bit about people health is a major concern. But for you, I know you had to make some adjustments because even though COVID was running rampant, it almost for a second, did it stop what you had to do as far as being that orthopedic surgeon?
It nearly stopped us. We had to very, very quickly accommodate and adjust to telemedicine. Now, telemedicine is something that I think doctors know about or knew about, but most doctors weren't implementing in their practice, especially doctors who are surgeons. Doctors who are surgeons are used to really interacting with patients in a live setting and doing surgery. So for a surgeon to do telemedicine, it was something that we had to learn very quickly and had to adjust to. And I had a very good technical team who was able to implement a telemedicine platform, which allowed me to interact with my patients virtually. And that was very, very beneficial during the pandemic because it gave the confidence to my patients that I was still around and could still provide services and could give them updates as to if they needed surgery, when that surgery could be performed. It also allowed me to see new patients who, like you mentioned, who have conditions that were not COVID-19 related, but needed to be addressed. People who broke their arm or hurt their knee or hurt their shoulder. These are problems which can be very painful and need to be addressed even in the time of a pandemic.
Yeah. So how do you navigate that? I mean, when you talk about the potential for a broken arm or broken leg, and you got the order to stay at home, how do you make that adjustment?
Well, we are essential providers. So if somebody calls me and they had, as a matter of fact, I did have a young woman who was jumping on a trampoline at home and broke her ankle. So even though we were in the time of the pandemic, her ankle needed to be fixed, and her surgery was considered urgent or emergent. So despite the fact that we were in a pandemic, I during the pandemic, my office was open on a very little limited basis, 1 or 2 days a week. I was able to see her in the office, evaluate her fracture, look at her x-rays, and we did her surgery as an emergency during the pandemic.
Yeah. So also for those who are, trying to navigate, post COVID, obviously for those, there are going to be some that are going to say, listen, I'll come out and I'll come to the office. I know that you still have that available as well. But then also you have the televisits. And so how effective have they been, and how much are people cooperating with televisits? Is there a lot of resistance to it?
I think I think initially both the doctor and the patient were both resisting, but I think we've all adjusted. It does take adjustment and it's very technical dependent. So I have to have good Wi-Fi. The patient has to have good Wi-Fi, and we all have to be. It has to be timed appropriately. That I'm on the call at the right time and the patient's on the call at the right time. If all those boxes are checked off and everything works out, it can be very, very beneficial, and it can allow me to interact with patients. Unfortunately, there's many patients in our society that are still maybe afraid to come to the doctor. They've heard in the media maybe older people shouldn't be venturing out of their homes. Telemedicine is a good way for a doctor like me to interact with those people. Sometimes older people who are not technologically savvy need a coach, maybe a younger person to help them navigate the technology. Hopefully they have a technology. Hopefully they have a smartphone or a good computer, and a younger person can act like a coach and coach that patient into how to use the technology, or maybe even set it up.
And that's important, to have a younger person who can hopefully help you set that up. I know I lean into my son all the time as well for some additional help, and I think I'm pretty good, but definitely getting some help in this season would definitely be good. So how about the virus and health? I mean, uh, aching joints, muscles. These are things that are also, a lot of people are contending with.
Yeah, I think the emphasis has to be that even in this time where maybe we're all a little bit frightened by the virus, by the pandemic, it's important to know that you can address normal or emergent aches and pains, and they can be addressed. You can see a doctor like myself. Our offices are open, and you can come in and interact with the doctor in a safe environment. Uh, when somebody chooses to seek care in my office, I wear a mask, and the patient wears a mask, and everything is done it in a very appropriate, socially distancing environment. We've adjusted the waiting room so there's not too many people in the waiting room. All our rooms are thoroughly cleaned before and after somebody goes into an examination room. So we've adjusted so that people who choose to go back and see a doctor in person, it's a very safe environment and it's very possible.
Well, we want to tell people definitely to take advantage of televisits, and definitely uh, in this season, it's going to be the way that we're going post COVID-19. Give me the final thing about. I understand you see about 10 patients a week, but how many? And that's in person. Give me a number about how many people you're seeing virtually before we go.
Um, Actually, we're seeing more and more patients in the office, but in the height of the pandemic, I was seeing probably 75 to 100 people per week via telemedicine. Now we're shifting back to seeing patients in person. Now we're returning to seeing 15 to 20 patients a day in person, and we're actually mixing up in-person visits with telemedicine so that we can abide by the social distancing criteria we have to follow.
Yeah. Well, certainly we'll continue to follow this as we are now reopening and seeing how that transition is going, how many more people will be coming in, and how many people will still be staying and doing it virtually. Dr. Wilson, thank you so much for being with us here on Open.
Thank you for having me.
All righty. Take care. And listen, we want you to stay with us as well. Listen, we do have more Open. We're just going to take a quick break and come right back. We got more show right after this.